Ten years ago, just before the first Global Forum on Nicotine conference in 2014, I chaired a session at a major smoking cessation conference in London. I wanted vapers to have a voice at professional events, and this was the first time that vapers had spoken at a stop smoking conference. It began badly. A friend was barred from entering the session. Our badges were colour-coded. His badge marked him out as a tobacco company employee. I found that I was at a segregated conference. People from tobacco companies could attend, but they were subject to a list of do's and don'ts. They were banned from participating in side sessions. The session itself was great. Speakers who had just founded the UK New Nicotine Alliance, a nicotine consumer organisation, gave expert testimony on their road to vaping. There were lively questions from the other experts in the room, the smoking cessation specialists. Immediately afterwards, I was approached by someone who identified herself as Professor Anna Gilmore from the University of Bath. Why, she said, had I not declared a conflict of interest? I was perplexed. I was well known in the field of drugs and harm reduction with over 40 years of research and advocacy, 200 plus publications, several books, and many millions of research funds behind me. I was hardly unknown. However, 18 months earlier, Paddy Costle and I had solicited a small research development grant from Nico Ventures, a then subsidiary of British American Tobacco. This was to design a study to test the impact of introducing a safer nicotine product in a prison. 80% of the prisoners smoked. Nico Ventures would provide Voke, prisoner could buy it, we would evaluate the uptake. Seemed like a promising idea. I was thrown by her question. Had I naively neglected a pre-session confessional? Why would she caricature me by one small part of my life's work? In her mind, I was tainted. And as it later turned out, even confessions of conflicts do not lead to absolution. This was my first encounter with the petty, paranoid, persecutory policing of tobacco control, with a self-appointed guardian of the Framework Convention on Tobacco Control. Article 5.3 of the Convention is designed to keep the tobacco industry at arm's length from government tobacco policy. It has been zealously over-interpreted to try to shame, stigmatize, and exclude. Anna Gilmore's ambition to police compliance with 5.3 was well funded, first by Cancer Research UK and later by Bloomberg Philanthropies. The modus operandi for her University of Bath Tobacco Control Research Group and its website Tobacco Tactics is to identify people with links to tobacco companies, however tenuous. Andy Rowell, their investigative lead, is adept at slippery wording that keeps the site just on the safe side of defamation. I'm not alone on their website. Many good people and organizations working on tobacco harm reduction have been included. 2014 was the year, at least in the UK, when public health experts were rattled by the rise of vaping, and they couldn't cope with their expertise being questioned. Towards the end of 2014, a public health grandee let loose on Twitter in what has been described as a Saturday evening Merlot meltdown. John Ashton, president of the UK Faculty of Public Health, let rip on vapers, describing them as trolls, as onanists, and hinting that they had, to quote, shadowy sponsors, end quote. Bizarre. John had a record of participatory public health and was an early proponent of needle exchange and outreach to drug users and sex workers during the AIDS crisis in the late 1980s. Insights not carried across to vaping. He tweeted a female vapor from the US, "Have you always been an anonymous C***T, or do you have a smudge on a personality and a human identity?" End quote. He was suspended from his presidency of the Faculty of Public Health temporarily. The attacks ramped up. Later in 2014, a prominent UK vaping advocate, A restaurant server with no experience of academic publishing got a comment published in The Lancet. What an achievement. She asked that experts listen to the views of vapers and asked for a more inclusive debate. This was met not by an inclusive debate, but by a miserable, sneering put-down in The Lancet from Martin McKee, a public health professor, Simon Chapman, a sociologist, and Mike Daub, a tobacco control campaigner. This was accompanied by Simon Chapman's tweet to quote, "Unctuous plea from a vaping activist who's cozy with trolls who post this stuff." I think there's a thread of misogynism running through these early attacks. The victim posted a response full of heartfelt and colourful expletives, ending with what is the best Twitter reply to Simon Chapman and his colleagues to quote, "Murderous, dickless, evidence-denying, public health bastards." Vapers see through pretentious, pompous public health posturing. But these public health leaders couldn't engage. This was an early sign of a struggle for ownership, with public health leaders discombobulated when challenged and resorting to personal attacks. Safer nicotine products and tobacco harm reduction were not invented by public health or tobacco control researchers. This left many tobacco control activists with little to do but to raise concerns, to raise fears, to raise suspicions, and to create uncertainty and doubt. They didn't understand vapers as potential allies. Over the last decade, there have been countless attempts to delegitimize, to stigmatize, to silence, and to exclude as many people at this conference can testify. It includes the exclusion from conferences of people with any links with the tobacco industry, however tenuous. It includes academic journals that silence authors with research funding, however indirect, from tobacco companies. It includes the University of Bath planting stories with journalists. Bath University will post something on its tobacco tactics website and then plant a story with journalists, including journalists that the university has funded. It includes attempts to pressure journal editors to retract papers published by grantees of the Foundation for a Smoke-Free World. And it includes, on a personal level, a friend threatened with contract termination if they continue to have contact with me or to attend GFN. I could write a whole book about tobacco control tactics, but life is really too short for that, and there are better things to do. My own experience is trivial compared with others in the tobacco harm reduction field, with others here in this audience and online and on this GFN panel. I'm thick-skinned and have learned to live with this. I'm fair game, but vapers aren't. Vapor advocates see the immense potential of safer nicotine products. Many post on social media. Some have formed small grassroots advocacy organizations. They are the true public health workers, small p public and small h health. In many areas of health, governments and public health agencies respect and consult with consumer pressure groups. But vapers' voices are vetoed. Vapers are viewed with suspicion and thought to be in the pay of big tobacco. This is unsurprising. Many in the paranoid world of tobacco control, including academic researchers, suggest inaccurately links between vapers and tobacco companies. Two examples, both from the BMJ journal called Tobacco Control. In 2020, an article by Patana Vanic and Glantz purported to show that the Thai consumer advocacy group ECST had links with Philip Morris International. They put statements from ECST alongside statements from PMI. The authors of the article imply that because the two organizations were active at similar times and had similar messages, they must have been collaborating. This is fantasy research based on a theory of similarities. In 2020, in another paper in the journal by Lindsay Robertson and colleagues, they analysed tweets at the time of the Framework Convention on Tobacco Control COP9 meeting. The University of Bath press release announced vaping advocates critical of global health treaty linked to tobacco giant. Vapers and vaping organisations had good social media around the COP event. Others were also tweeting, including staff at PMI. Robertson implies that vapers and PMI are thus linked. Like Patanavanich and Glantz, the research is based on a theory of similarities. This leads to a fantasized methodology purporting to show underlying sinister forces at play. It's a kind of a pseudo-causal synchronism. It's not science. This is not just a nasty mudslinging game played by academic teams and journals. Attacks have consequences for reputation, for employment and careers, for the ability of individuals and organizations to engage with governments. In some countries, allegations bring risk of personal harm. How can academic and public health tobacco control activists get away with this? For example, why don't the good people in tobacco control speak up against this? None do. Perhaps they don't care. Perhaps they agree with the attacks. Perhaps they fear guilt by association if they speak up. Perhaps they don't want to rock the boat. Many of them are in collaborative research networks and in joint authorship. In my mind, their silence is complicity. In a weird way, it seems to me that tobacco control activists need enemies. And rather than engage in debate, the tobacco control tactic is to exclude, ban, and stigmatize. Voices are vetoed, vapers' voices are vetoed, potential allies in the switch away from smoking are silenced. And running through all of this is a kind of a blame. Tobacco control, it appears to me, needs people to blame, and blaming intentionally or otherwise defers reflection on its own failures to reduce the numbers of smokers globally. What of the future? Can anything be done? Well, every opportunity should be taken to raise objections to university ethics committees who fail to protect people, to journal editors and editorial boards that publish inconceivably bad articles, and to academic institutions which accept funding for activist tobacco control work, and of course complain to professional organizations. There will be occasional victories, but they will be few and far between. The attacks won't go away. Finding enemies is now so embedded in the psyche of tobacco control activists and their institutions. The witch hunter mentality is so ingrained and so well funded that it can't be turned off. There is no interest in finding common ground. It is, unfortunately, something that we have to learn to live with. But this doesn't diminish my optimism about tobacco harm reduction. Tobacco harm reduction is driven by consumers and it's supported by good, safer products. The demand for safer products will drive this. Tobacco control activists can try to stand in the way and they can try to censor opposition. They are an irritant and they are a waste of time. But in the long term, the trajectory is clear. It's not whether tobacco harm reduction will succeed or not, but when. Thank you.